everyone, this is Dr. Salma with American and UK Ozone Aesthetics. We are here today at AASP 2024 Conference. And today we're going to be talking with lots of people who are the lead and great in doing what they do. So check it out. We're going to be talking with the whole list of dermatologists, plastic surgeons, and many, many more. All right, everyone, we are here again at AASP 2024, and I have another amazing guest here. We are with the plastic surgeon, renowned, amazing Dr. Sheraz Raza. There we go.
Thank you so much.
Thank you for being here.
Thank you for
giving
talking
us your time. And tell us a little bit about yourself, people who don't know.
Yeah, okay, so I'm a plastic surgeon.
Yes.
Yeah, I've done my FCPS in plastic surgery, I've done my FRCS in plastic surgery, I've done my fellowships, a couple of them actually. One in hand surgery and microsurgery, and then in cosmetic surgery from Rotterdam, Holland, and from Singapore. So I came back to Pakistan in 2014, and I've been practicing since 2015. So by default, I became a cosmetic surgeon. I never wanted to. But the way the things go, so gradually I became a cosmetic surgeon. So now my 100% practice is cosmetic surgery. I'm based in Integrated Medical Care Hospital, DHA Phase 5, and that's my full-time practice there.
Well, amazing. Well, do you guys even understand everything he has done? I mean, he spent most of his life just kind of studying and honing in your skill.
In a way, yes.
And I'll tell you another thing. So you just give me hope. Like, you've been in Pakistan. You said you came back to Pakistan in 2014.
Yes.
And you're here 10 years later.
Yes, I am. And I don't plan to go anywhere else.
Okay, amazing. So that gives me hope. I'm here just a little over a year now. So, I mean...
don't worry. I think if Lahore loves you, if Pakistan loves you, you don't need to go anywhere.
All right. Well, that's very good to hear. Pakistan is an amazing place, of course. So in your practice, what do you see the most?
Actually, I think it depends upon what do you do the best.
Yeah.
That's what defines it. I do a lot of rhinoplasty, nose jobs.
Okay.
As you can see that, surgical. Almost all of them surgical. Of course, non-surgical as well, but most of my work is surgical. And because the world has been transformed in recent years by a Turkish influence of rhinoplasty, where there's certain kind of a rhinoplasty going around.
Yes.
So for a person to be doing proper Oriental demographic rhinoplasty is a little rare, because people are doing the same thing again and again.
Copy and paste.
So I kind of thought that I should learn it. So I tried learning it from a lot of people. I wouldn't name where I went and how far I went to learn it. But having been doing it for so many years now, I feel none of the two noses that I make are similar. So I think that says for itself that it is a really complicated procedure, and it needs to be done on merit.
You're very right, and it is very, very true. No two things are going to be the same, and it is very important for patients to understand.
Sure.
What do you think is a challenge in Pakistan, especially as patients are coming? Do you feel that they're coming in a certain mindset, and do you have to educate them? Or do you feel that you are patient well equipped and they have knowledge?
Okay, so I always tell my students and my team as well that never underestimate the intellect of your patients, because if you think that they're not very intelligent, then that means they're making a mistake coming to you.
Right.
So if they've come to you, they've done their homework.
They've done
so
homework.
They're not there by chance.
Right.
Even if they are, it's going to be 1% and by max, and that number keeps reducing over a period of time. So you have to give results and you have to deliver. We are living in an era of social media.
Correct.
Where you get exposed under the microscope every single day, every single time. People expect to see something original. And if we think that we can fake it and we can kind of put people away by putting photographs with filters and that sort of stuff, then that's not true. I've been working on it, and I have realized that what sets the bar high is your own expectations for yourself.
There's no better competition than yourself.
Absolutely.
Yep.
So I feel my patients are really prepared now, number one. Number two, there was a teacher who taught me once that when a patient comes for consultation, he's bought your time. And it's his time.
Yes.
And it's you are on his time. So you can, I mean, even if you realize what needs to be done within a fraction of a minute, you still have to give them enough time. And the more time you spend with them, the more you realize how clear they are in their heads. So as a cosmetic surgeon, I need to get into the brains of people because I really need to know what they are expecting out of it. Because if I can't, it is wrong in at two levels. Number one, I couldn't judge it properly, and number two, I'm in for a chaos because if I don't give what they want, even if it's by world standard, by bookish standard, it is the most amazing thing in the world. If they don't like it, it's a failure. So no, I think our patients are as intelligent as anywhere in the world. They do their homework,
yes,
and they're pretty well prepared and well versed for whatever they want.
So it is very important to really connect with our patients,
Absolutely.
really understand what their needs are, and then accordingly give them time. Don't rush into anything.
Absolutely.
Then take action. It doesn't matter whether
Absolutely.
you're doing surgery, whether you're just doing anything that is non-surgical.
I feel connection is important.
Absolutely.
I think sincerity is even more important.
Yes.
And I think your honesty counts the most.
Absolutely.
If you do a procedure that you wouldn't get it done on yourself, I think that's where the problem lies.
That speaks the volume, I would say. If you're not willing to do something for yourself or for a family member,
Absolutely.
don't offer it to a patient.
Of course. So I think that's what makes a difference between a good surgeon and a great surgeon, when he starts putting himself in their shoes.
Absolutely. So tell me, as of course you're a surgeon, so we're talking about surgery, but otherwise, people who are looking for great skin and not necessarily looking for just, surgical solutions. So what would you suggest to patients who are just, wanting to do the right thing? What are your best suggestions?
Frankly, it's a very, very difficult question. It sounds very, very simple, but it is not. So I kind of never tell anybody what needs to be done. I just ask, I think my first 30 minutes of consultation is to make peace with whatever you have. That is the most important thing.
Okay.
And then we build it from there, what can be gotten rid of and what we can't. For example, in my personal practice, I might be totally wrong about it, a melasma, the pigmentation, it never goes away.
Problem.
It never goes away.
It never goes away.
So if you keep making your patient, giving them a hope, and then not able to deliver every time, that means that you really do not know what you're doing. So similarly, skin, you really need to know that what will work and what will not. So you have to see that patient needs volume,
yes,
hydration, or clarity of the skin, and then decide, can you give it or not?
There's a lot of misconceptions about melasma overall, and people are looking for, sometimes a lot of patients will come and they're looking for a quick fix, not necessarily trying to go to the root cause. Melasma
Exactly.
is a multi-systemic issue.
It has to be related to something.
It has to be related to something else. So yes, we need to take time to make sure where the problem is and then address it accordingly.
Yes.
So, but I love your approach. Absolutely fantastic. And I absolutely love the sincerity and the honesty you put in.
Love talking to you. Love talking to you.
Thank you so much.
Thank you so much.